Welcome to the NBCOT exam practice test. Our topic today is practice test number 2. Use the link in the description to download the app on the App Store for free practice tests. Number 1. How many grades of eye response in Glasgow Coma scale? A4, B5, C6, D7. The correct answer is A4. Explanation. There are 4 grades of eye response in Glasgow Coma scale. 1. No eye opening. 2. Eye opening in response to pain stimulus. A peripheral pain stimulus, such as squeezing the lunula area of the patient's fingernail, is more effective than a central stimulus such as a trapezius squeeze, due to a grimacing effect. 3. Eye opening to speech, not to be confused with the awakening of a sleeping person. Such patients receive a score of 4, not 3. 4. Eyes opening spontaneously. Number 2. What type of seizure involves loss of muscle tone for more than 30 minutes? A. Absence seizures. B. Myoclonic seizures. C. Akinetic seizure. D. Tonic-clonic seizures. The correct answer is C. Akinetic seizure. Number 3. When does hand dominance begin to develop? A. 3 to 6 years, but is not fully defined until 6 years. B. 4 to 6 years, but is not fully defined until 6 years. C. 3 to 7 years, but is not fully defined until 7 years. D. 4 to 7 years, but is not fully defined until 7 years. The correct answer is A. 3 to 6 years, but is not fully defined until 6 years. Number 4. At which age can an infant sit erect and unsupported for several minutes? A. 6 to 7 months. B. 7 to 8 months. C. 8 to 9 months. D. 9 to 10 months. The correct answer is C. 8 to 9 months. Number 5. What type of seizure involves contractions of single muscles or muscle groups? A. Absence seizures. B. Myoclonic seizures. C. Akinetic seizure. D. Tonic-clonic seizures. The correct answer is B. Myoclonic seizures. Number 6. Which level of work requires exerting 50 pounds occasionally, 25 to 50 pounds frequently, 10 to 20 pounds constantly to move objects? A. Light work. B. Medium work. C. Heavy work. D. Sedentary work. The correct answer is C. Heavy work. Number 7. What is phase 3 of the normal adult swallow process? A. Esophageal phase. B. Oral preparatory phase. C. Oral transit phase. D. Pharyngeal phase. The correct answer is D. Pharyngeal phase. Number 8. What is the characteristic of manual wheelchair code K0005? A. Standard Hemi wheelchair, 17 to 18 inches. B. Lightweight wheelchair. C. Ultra lightweight wheelchair. D. High strength, lightweight wheelchair. The correct answer is C. Ultra lightweight wheelchair. Number 9. What functionality does a person with Lou Gehrig's disease stage V have? A. Confined to bed and dependent for activities of daily living and self-care. B. Can walk but has severe weakness. C. Can walk, independent with activities of daily living, some distal weakness. D. Requires wheelchair for mobility, dependent for activities of daily living, has severe weakness in upper and lower extremities. The correct answer is D. Requires wheelchair for mobility, dependent for activities of daily living, has severe weakness in upper and lower extremities. Number 10. In a child with cerebral palsy, what is a flaccid limb characterized by? A. Markedly low tone. B. Constant fluctuations from low to high tone, without co-contractions. C. Generally normal tone, but involves flexor patterns in the lower extremities. D. Tone that fluctuates from low to normal with little spasticity. The correct answer is A. Markedly low tone. Thanks for watching. Don't forget to like, share and subscribe to our channel for updated videos every week.